Hi, this is Randy. This is Sex Addiction-Induced Trauma continued. I'm continuing to read Dimension 7, Sex Addiction-Induced Perpetration. There are many abusive attitudes employed by others and society against partners and spouses of sex addicts. There are agendas that are enacted, ways of managing the addictive system, and other dynamics of abuse, violation, and perpetration that fall under the umbrella term of sex addiction-induced perpetration. Sex addiction-induced perpetration can include marital rape, and sometimes does. Sex addiction-induced perpetration can include dynamics of coerced sex with a partner or sexual manipulation. Sex addiction-induced perpetration may include collusion in acting out with the partner's friend, or may include the other people whom she honored and trusted, who may have known and colluded in denial and silence, or even supported the acted out. Sex addiction-induced perpetration can include impacts on children, including parentification, using children post-trauma as self-soothing objects, objectification of children based in sex addiction-induced trauma responses, post-traumatic unhealthy alliances within family systems, sex addict blaming child for only sexual acting out, the sex addict blaming a child for their own sexual acting out. Oh man. Permitting and allowing misrepresentation of truth socially. Sex addiction-induced perpetration is most often a system of thoughts, feelings, and behaviors. All forms of sex abuse as sex addiction-induced perpetration should be identified and integrated into the clinical treatment and management paradigms. Indeed, sexual acting out behaviors are but only one form of perpetration. Dimension 8 is called sexual trauma. There can often be trauma to a partner's sexuality, inclusive of traumatic incidents and ongoing traumatic patterns that traumatize a partner's sexuality. Ongoing systems of sexual and gender domination, control, and utilization and violation of a partner's body and sexuality may sometimes exist within intimate partnerships impacted by sex addiction or compulsivity disorders. The sexuality of a partner is often impacted by addiction in a similar way that women who have been raped or sexually traumatized are impacted in terms of symptom similarities. Bingo! The sexual symptoms that partners often experience correlate with symptoms of rape trauma syndrome. Symptoms of SAIT on a partner's sexuality may include avoidance or lack of interest in sex, sexual shutting down, collapse and numbing, somatic genital and sexual symptoms, sexual traumatic constrictions, fear and panic about having contracted a disease or infection of a sexually transmitted disease, psychological sense of, quote, being dirty and feeling contaminated, confusion around self-blame, post-trauma-induced hypersexuality, impulse to hide in context of shame, fear and anxiety when reminded of sexual SAIT intrusions, internalized obligatory sexual pleasure as a victim, varied aversions to touch or intimacy, aversion to physical holding, physical contact, and sexual activity, sometimes with any human being and sometimes more specific to the perpetrator. SAIT, reactivation and re-experiencing via visual, auditory, cognitive, or actual experiences of sexuality and deep gender wounding and gender-based trauma. So as the narcissist was calling me asexual, he was actually causing those feelings for me. The more one studies female sexual realities, the more one becomes aware of our modern-day human atrocities, yet unveiled. Sex addiction, compulsivity problems, and disorders not always but can sometimes include sexual rape, inclusive of marital rape. And isn't that what I've talked about? This is a serious problem that is rarely discussed in and out of professional realms and needs to be. Some partners of sex addicts are raped as an ongoing system of sexual domination and violation, sometimes in the name of various constructs of marriage, religion, or gender expectations and obligations. Rape and pressuring around anal sex exists. Forms of dissociation and detachment during or around sexuality is a vital symptom and coping strategy utilized by many partners to endure sex in which their true will is not being honored. Yes. In such cases, symptoms of rape trauma syndrome will likely emerge and intersect with SAIT and will require specific gender-based clinical context and consciousness with appropriate clinical nuance, with both differentiation and integration. The sex addiction-induced trauma model rejects on both academic and ethical grounds the diagnostic and clinical conceptualization or use of the word sexual anorexia. Thank you, thank you, thank you. Dimension 9 is called gender wounds and gender-based trauma. To the extent that there is gender subservience as a mandate of repression, then there exists gender-based violence as a factor that serves to maintain the subservience. There are myriads of dynamics informed by gender-based violence causing symptoms of gender-based trauma in all of us and in humanity. Partners and spouses often experience significant gender-based trauma based on patterns of gender-based violence and abuse associated with sex addiction, compulsivity patterns, and perpetrations, including the harm they may endure from clinical treatment interventions. Trauma disorders and symptoms are known to be traditionally misdiagnosed and underobserved or attended to by psychological interventions, particularly when it comes to trauma symptoms among girls and women. Partners are often profoundly impacted at the core of their gender and gender identity, which often includes damage to ego structures and core gender constructs such as wife, mother, father, male, female, sexual being, worthy being, body image, and core gender esteem, worthy, human, etc. The impact of gender wounding and gender esteem on overall psychological health and functioning is often not recognized and often rendered unconscious. However, gender identity and gender esteem is a primary and core dynamic in self-construction, core self-esteem and self-worth, and is foundational to global psychological functioning and adjustment. It is very closely related to sexuality, yet in a clinical system of traumatic injuries, it is delineated in order to more fully appreciate and understand stand the traumatic wounding in service of repair and integration of reintegrated gender fragments, gender esteem, and the reconstruction of gender in a post-SAIT clinical context. Included under this dimension is the context and dynamics of gender-based violence that infuse and inform many of the dimensions, including treatment-induced trauma, as the co-sex addiction model propagates a psychology of victim blaming as a derivative of gender-based violence. Nice. Also included in this dimension are all the victims who are women of color, women who may not have legal status, female domestic employees, domestic nannies and babysitters, homeless or poor girls and women, sex traffic victims, and sex industry victims, and pornography victims who are directly or indirectly impacted by sexual acting out disorders and sex addiction. Gender wounding and gender-based trauma is considered to be a critical injury for many partners impacted by SAIT. And isn't this the shit that I always am talking about? Dimension 10, relational trauma and attachment injuries. And this is what I actually got diagnosed with, so I did have quite a smart therapist when I went to therapy in 2013, before this article even came out. Healthy and secure attachment to human beings is essential to psychological health. Disconnection from human beings results in pain, dysregulation, and disease. Rupture from what was experienced as a secure attachment, which included psychological and emotional dependency, is a traumatic and critical event and dynamic in itself. Relational trauma and attachment injuries, inclusive of attachment rupturing and the traumatic relational dysregulation within the system of the coupleship or relationship, is another critical injury of SAIT according to the SAIT model. The SAIT model asserts clearly that sex addiction-induced trauma is not to be reduced to, quote, relationship trauma or, quote, attachment trauma only. Oops. But included as one important clinical traumatic source and yet only one of the critical injuries, along with dimensions 3, 9, and 12. I'm going to end this video here and pick up the next one, continuing the explanation of relational trauma and attachment injuries. Thank you.